Hi, my name is Desiree. I'm the volunteer coordinator here at AMOS.
And my name is Andre, and I am the Global Health Education Fellow.
And we're going to be talking about the 2015 AMOS Global Health Practicum and internships for this summer, which we're very excited about. So I want to go over the agenda so you know what we're going to cover. We're going to start talking a little bit about AMOS and Nicaragua so you can have a general context of why we work in Nicaragua and how we work there. We want to explain a little bit about our model, where it comes from and how we implement it in the rural communities. Also, we're going to be talking about the Global Health Practicum curriculum and the timeline so you have an idea of how that itinerary is going to look like. Also, we want to discuss the internships or the fieldwork extension, which are the last 6 weeks of the summer, where we're going to be talking about the 4 opportunities that we have, which are the women's empowerment and nutrition, the youth empowerment, the clean water internship, and the community health worker. And lastly, we're going to talk about logistics and application details, so you know what documentation is still pending for you and when you have to send all of that in. And then we're going to start talking about the AMOS in Nicaragua. So, as many of you probably know, Nicaragua is the second poorest country in the Western Hemisphere. And 45% of the total population is rural. So that's where AMOS works most of the time. Even though we do have an urban clinic here in Managua, most of our work is in the rural communities. 70% of the population is in a poverty state, and the communities are also very geographically dispersed with low access to health services. A lot of these communities will be, distances from 2 hours to 8 hours away from the nearest health center. And even in the same community, in the same village, you'll see that the area between one house and another can be as far as 1 to 2 hours away. 77% of the rural population lack access to potable water, so you can understand why one of our biggest programs is a clean water program where we work with water filters. And also, poor children are 3 times more likely to die from preventable diseases such as diarrhea, neonatal sepsis, and pneumonia. So we work a lot with mother and specifically with children under 5 years of age to try to improve their nutritional levels and give them, the ability to overcome all of these diseases that are very common. So you can also check our website, which is to summarize here what our mission and values are. AMOS is a Christian nonprofit organization, and we exist to improve the health of impoverished communities by working alongside them in health education and development. So a word that we'll use a lot here is empowerment. We want to try to give the community members the ability to solve their own issues, and we're just there to help work alongside them, not at them, or only in them. And also the values. By seeking these partnerships, we want health for all people, a world where no child dies of preventable disease, and effective and empowering healthcare. So where we work, here's a map of Nicaragua. Currently we work in 32 communities, and we work in 4 departamentos. Departamentos are like states in the U.S. And the 4 we work in are Chinandega, Matagalpa, Buaco, and Larraz. And then we have 1 urban clinic, like I was mentioning earlier, in Nejapa, which is about 5 to 10 minutes from Managua. And we've been operating since 2006. For this summer, we'll be working very closely in the communities of Larraz, where you see the number 5. We currently work with 5 communities there, and all of the internships will be working in 1 or 2 of these communities.
So now that we've established a little bit of background about AMOS and the Nicaraguan context, now we're going to move a little bit more into discussing the AMOS model before we jump into the practicum details and the internship. So our model is firmly centered in this idea of community-based primary health care, which is basically a way that health can be created and done by the communities, and us serving more as facilitators or guides to make that happen. And so 3 of the strategies that AMOS uses to decrease health inequities within this umbrella of community-based primary health care. One is intersectoral collaboration, so looking to work with different entities such as the government, the community, ourselves, and other groups. Also, the use of evidence-based interventions, so looking at the literature and seeing what's out there, and then implementing what is effective and how we can tailor that specifically to the communities that we work in. And then, as Desiree had earlier mentioned, there's a huge focus on community empowerment. So not only providing access to the services in terms of health, but also getting the community to learn about who they are, the strengths that they have, and the ways that they can mobilize themselves to seek the dignity and humanity that they deserve. So just to go over the 3-way partnership, that's kind of the cornerstone of a lot of the work that we do. AMOS seeks to mobilize a 3-way partnership through 3 entities, being the community, ourselves, and then the government. And so it's working with the Ministry of Health here in Nicaragua to look at the different interventions that they have in terms of primary health care and trying to make those work in the communities. So mobilizing that knowledge and resources, working with those government officials, and trying to get the community to work more closely with the health ministry so that there's a stronger partnership between the 2 of them, which then allows for greater access to services and greater community empowerment. So with under the umbrella of community-based primary health care, we have a lot of different programs that AMOS is currently running, which you can see on the screen ahead of you. So a huge area of that would be community development. We do a lot of youth empowerment work, as well as women's empowerment. Additionally, we have a safe water and sanitation program that provides water filters, as well as education to school children about the use of safe water and families as well. And then a huge area is maternal and child health. So rural primary health care delivery, providing basic medications to communities, also collecting nutrition and anemia baseline data collection, and then prenatal care support, as well as some behavior change and community doula programs that we're implementing to help these communities. So now we're going to jump into the Global Health Practicum curriculum and timeline. First, just an overview of the practicum. The great thing about the practicum is that you're going to get incredible hands-on experience within the field of global public health, as we say. So over 120 hours of training and field work, really getting to grasp more the health challenges and rewards of rural primary health care delivery. So getting to see firsthand, visiting these communities, seeing how the system that AMOS has works and what's good and what's hard about making community empowerment a possibility for these areas. And then another great piece to mention is that the global health fieldwork and research that you would be a part of is guided by some really, really excellent preceptors out there, those that have their MDs, some have their MPH, and some have both. So there's just a huge variety of experience within the team that you can access. So some basic curriculum highlights here. We'll be talking a lot about community-based participatory research and how that has to do with our community-based model of primary health care. Also talking a lot about power and privilege, understanding what lenses we bring to the table in working with those on the margins. Also talking again about community empowerment and social determinants of health, and as you can see, many other different topics in terms of Nicaragua and the empirical realities that these communities face when it comes to access to clean water and whatnot. We'll also be doing a lot of training in some biostats analysis and fieldwork data collection so that you guys really get a strong grasp on what it means to be doing field work and all that is comprised in that. And then also kind of talking about the different vertical and horizontal interventions, how AMOS works to incorporate vertical in our horizontal method by doing health system strengthening. So here's just a brief overview of some of the course instructors provided basic information on where they've done their training and whatnot. So you can see it's going to be a really diverse group of people that bring a lot of different experience from their travels, both Nicaraguans and U.S. Physicians and public health specialists at your disposal. So looking at the practicum timeline now, the practicum lasts for 3 weeks, and the first and third week being here at AMOS, at our AMOS campus here in Managua, where you will be involved with lots of classroom discussions, lecture, immersion into all of our strategies, doing a lot of reflection, a lot of reading, and just really getting into the nitty-gritty details of a lot of the ideology and philosophy that we carry out. So that's weeks 1 and 3, and then week 2 really is the exciting part where you get to go out into the community and really understand how does all of this ideology, all of this theory fit into everyday practice. And so you'll get to meet the health promoters in these communities, understand how a health committee works, how they mobilize their communities, listen to the different voices that are in that community, and then also see the various interventions that we do, getting to be a part of water filter supervision, doing home visits, doing data collection, doing different screenings, etc. And so you basically get to get your hands on multiple different areas, and that will really enrich the classroom learning experience in weeks 1 and 3. So now, after the practicum, we also have fieldwork extension opportunities available for those that really want to get involved more in the field and understand greater the complexities that are involved. So as Desiree earlier mentioned, we have 4 different internship opportunities: the Clean Water Internship, Women's Empowerment through Nutrition, Community Health Worker Internship, and the Youth Empowerment Internship. So after the 3 weeks of the practicum, then you would complete 6 weeks of the internship, totaling to 9 weeks total working with us at AMOS. As I was saying, just some of the highlights is getting even more in-depth exposure to the way our system works, the data collection that's involved, and a lot of the difficulties that we challenge working the field, crossing different cultures between urban and rural in Nicaragua, and even being from the U.S. and Nicaragua itself. It'll really allow you to apply a lot of the skills that we talked about in the practicum and further understand them rather than just getting a brief overview. And as Desiree was also saying, it'll be all focused in La Ras, which is a great opportunity for you as we're starting a new model there that allows greater connection and networking with the promoters, as we're calling it, the municipal model. So now to just go over briefly the different internships and what they have to offer. First, we'll start with the Clean Water Internship. So if you're interested in this internship, you're going to get to work pretty closely with the Clean Water Program, doing baseline analysis in La Ras to kind of create community profiles in terms of access to potable water. You'll also be doing some CAP survey, which is looking at people's knowledge, attitudes, and practices in terms of water and its cleanliness and the usage of using clean water in their lives. And then you're getting to participate in water filter supervision rounds to test the use of the water filters. This in conjunction with the community health worker internship. The clean water interns will also get to participate in helping train water health promoters that we're starting, WASH promoters as we are calling them, which will be a really exciting time and a new intervention that we're starting out. So basically training promoters in the community to be able to go house to house and do home visits to make sure that the filters are being used correctly and that we are making most access as possible as we can for these communities. So the Women's Empowerment and Nutrition intervention is a really exciting one as well. It probably focuses more on qualitative analysis and data collection here, but you'll be a part of collecting baseline nutrition and anemia data, analyzing different feeding practices, understanding the issues and behaviors that are associated with proper nutrition for children, and also you'll be working on creating didactic materials that we currently have created, but validating them and trying to understand, are the nutritional messages that we have on these materials reaching the mothers in the most effective way. So this one is for those that are really, really fascinated with the more anthropological side of public health and wanting to know a little bit more about behavior and behavior change. Then after this, there's a youth empowerment intervention. So if you're really interested in working with youth, I would suggest this one to you guys. Basically, you will be implementing a youth empowerment program that has been previously created by AMOS in one of the communities in La Ras. But not only will you just be implementing it, but you'll really get to get your hands deep in revising it, understanding how can we make this more palatable to the youth in this community. And this, of course, will allow you to connect relationally with the youth in the community as well. You'll be participating in different methods that we use here, such as photo voice and seed scale methods, to help understand a little bit more how can we decrease some of the issues that the youth face in these communities and help them feel empowered and able to make decisions and thus change the trajectory of their lives and their future family lives. And then finally, as I previously mentioned a bit with the community health worker internship, you'll be involved with the training of the water health promoters, and you'll also be helping with a lot of baseline data collection in terms of knowledge, attitudes, and practices, and that will be more towards collecting census baseline data. So in every community, we go home to home to make sure that we can count for everyone in that community, looking at any previous health issues that they have had, and then being able to consolidate that data with the health promoter and the health committee so that we can create a risk map of the areas and the families that are most in danger in these communities. So you'll get to help and develop a lot of the different training materials with the community health workers, and get to see more of the health promoter side of their work. How do they organize a community? How do they work to empower their health committee, and the various rewards and challenges involved with that.
All right, and now we're going to finalize by talking about the logistics and application details. During your time in Managua, you would be staying at the AMOS guest house. And then during your time in the rural communities, you would be staying in closed areas such as schools, churches, or the clinic. But you will be always staying in a closed area and with a team. Unlike we were mentioning, this would be in the communities of La Ras. And then weekends are free for independent travel. Just so you have an idea of the itinerary during the 6 weeks, it would be 2 weeks straight out in the rural communities, 1 week here in Managua, then 2 weeks 2 weeks out in the community again, and then 1 week, the final week in Managua. So therefore, you will not have that many weekends available, but you will still have time to go and visit, different places here in Nicaragua. We also have a planned team excursion after the first week of the practicum. And we have the possible excursions here. We have Laguna de Apoyo, San Juan del Sur, or Volcan Mombacho, and you guys can do some research on that. And I'm open to hearing suggestions and votes on what you'd prefer to do that weekend. So we have several requirements to complete the application. First, we start with an online application, which you can get by either looking it up on the website or emailing me. Also, I need you to submit your resume and cover letter along with 3 references sent to my email, and we'll be contacting all the referees directly via email. So I just need their contact information, actually. Also, we request all volunteers to complete a background check through International Ministries. Also, email me, and I'll be sending you our contact information so you can start the process. If you're wanting to send me examples of recent work, that's optional as well. It's always good to see some samples and see the level of Spanish as well. So once you complete all of these requirements, we'll be sending a volunteer packet that includes a medical and waiver form, a code of conduct, and additional information that will be very helpful, such as health tips and a travel guide. I will also be setting up interviews with all the applicants once they complete at least the online application. And this way we'll be able to talk a little bit more about the program and learn more about the applicant as well. And also we like to have a little Spanish test during the during the Skype interview just to kind of assess what the level is. So costs, you can also find these on the website. But just to give you an idea, the practicum has a total cost of $2,650 is for food and lodging, and the rest are for project costs. And by project costs, we are referring to pre-trip planning and logistics, which, as you can imagine, takes a lot of coordination and a lot of staff is involved. It also includes airport pickup and drop-off, all printed course materials, all fieldwork supplies as well. And then for the internship, the total cost is $2,500, $1,100 for food and lodging, and $1,400 for project costs. So the total for the summer for the 9 weeks is $4,500. And please remember that these costs do not include airfare, although we can make recommendations on agencies that we've worked with that can give you a better fare. So feel free to contact me at volunteer.coordinator@amoshealth.org with any questions that you might have. We're looking forward to hearing from you, and we're very excited about this summer practicum and internships.